Hi, welcome to the American Academy of Optometry Foundation Clinical Podcast Series. I'm your host, Kim Duong, and today's topic is the association between depression and severity of dry eye symptoms, signs, and inflammatory markers in the DREAM study. Today's topical expert joining me now is Dr. Elizabeth Hoppe. Welcome, Dr. Hoppe.
Thank you so much. I'm very happy to be here this morning.
Yeah, thanks for joining us. Can we start off by having you share a little bit about yourself to us?
Fantastic. So I am really privileged to be the founding dean of the College of Optometry at Western University of Health Sciences. And for my academy connection, I have two sections that I love working with. I'm a diplomate in the public health and environmental vision section. So I'll definitely be bringing a public health perspective to our conversation today. I also have been active on the diplomate committee for the optometric education section. And so that's the second hat that I'll be wearing, is maybe thinking a little bit about incorporating some research into the educational arena.
Awesome. Well, we're so glad that you're here with us today. So let's dive right in. Can you tell us a
Okay.
little bit about this paper?
So the background and why I was interested in this topic is we know that all day, every day, optometrists see people with dry eyes. And we also know that optometrists see people with depression. So is there any relationship between these two conditions? So let's think a little bit about the prevalence of depression first. According to the CDC Pulse Survey, that is a survey of the prevalence of depression among adults in the US. And the statistic I'm going to give was measured from September 20th to October 2nd, 2023. So it's very current. And they found the prevalence of depression was 28.5%. So about a quarter, if you go by the population statistics, about a quarter of the US adults will have depression. And we know that that's going to come forward into our optometric clinical setting as well. So this paper is a secondary analysis of the data from the Dry Eye Assessment and Management, or DREAM study. Now, the original paper was a multi-center randomized placebo-controlled clinical trial. So it was gold standard, really good clinical work. And they evaluated omega-3 supplements for the treatment of dry eye. So the researchers of this paper did the secondary analysis, and they wanted to look at the relationship between depression and dry eye. Now, there were three areas of interest for the dry eye measurements. They looked at symptoms, signs, and inflammatory markers. And they looked at the relationship in two ways. First, they compared the symptoms, signs, and inflammatory markers for people with depression and people without depression. And second, they looked at the correlations of the severity of the dry eye measures with the severity of the depression. Now, the primary way that they measured depression was the mental component survey from the SF-36, and they also asked for self-reported depression and use of antidepressants. In this sample of the post-secondary data analysis, there were 84 people, or about 15.7% of the subjects who had depression.
Yeah, very interesting. Dry eye and dry eye is definitely one of the most common complaint I get in clinic. And so,
Sure.
um, as a clinician, how do you think this research is going to be, important to us and can be translated in clinical practice?
So I think one of the key findings for us to think about is when they compared people with and without depression, the researchers found that people with depression had more symptoms of dry eye disease. And that's even when they controlled for age, sex, race, and comorbidities. People with depression also had worse composite severity score based on the clinical signs of dry eye. Now, the inflammatory markers showed mixed results with no clear associations. They also found that people with more severe depression had more severe dry eye disease symptoms. However, the severity of the depression was not strongly correlated with the severity of the clinical signs. So basically, they're definitely finding some type of an association between dry eye prevalence, dry eye symptomology, dry eye experience is somehow associated with depression. And it gets worse with more severe depression. Now, I think it's really, really important to know that while there was a statistically significant difference, the clinical application and the clinical significance of these results might be questionable. And the reason is because of the small effect sizes. So the way they measured the results were both the OSDI and the BODI, which are standard measurements as related to the dry eye symptomology. Both of those instruments are scored on a scale of 0 to 100. The effect size for the difference in people with and without depression was only found to be 0.45 for the OSDI and only 0.46 for the BODI. So that's actually a change of less than 0.5%. So while we're seeing the statistically significant association, we have to ask ourselves, does it really make a difference clinically when it seems to be a relatively small effect size on those two standardized scales?
Right. Sometimes, we see these statistical significance in paper that don't necessarily translate, right, to clinical significance. Um, so, in clinic with my students, one of the things that we go over is review of systems, medical history. And so, do you have any suggestions on potential questions that we really should be asking in order to, detect if our patients are at risk for depression or are going through depression?
Absolutely. I think it's really, really important. And I think it shows up in two different ways when we're having those conversations clinically. One is in terms of the medications. So sometimes people won't really want to share that they have a diagnosis of depression, or the other one that's very common now is anxiety. So if you're familiar with the medications that are commonly used to treat those conditions and you're doing the history of medications, that may open up the door and say, I noticed that you're on this type of medication that's commonly used for treatment of depression. How are you doing? How are you feeling? Are you feeling that your depression is under control? So a lot of patients may not have their depression fully controlled through their medication. So always double checking how they're doing. Now, the other thing that I think we want to talk a little bit about is the relationship in the paper is a correlation. And so we have to remember that correlation is not causation. So the authors really speculated, why is this happening? Are people with depression having different behaviors? Are there biological changes? Are there medication side effects? So when they looked at the behaviors, they speculated maybe people with depression have an increase in screen time. Maybe people are not going outside, they're staying in the house, they're maybe doing what we call, the doom scrolling behavior, some negative aspects. Maybe they're not connecting with people in real life. Maybe they're living a little bit more isolated experience. The other thing that they looked at as a hypothesis is to say, is there a change in pain sensitivity level? We know that people with depression also can have somatic symptomology that's real. They may experience pain in various parts of the body. So maybe they're having a change in pain sensitivity level that's related to dry eye symptomology. And then they also looked at whether the antidepressants could actually be the root cause of the dry eyes. Now, the authors did find that the dry eye disease signs were not different according to the use of the antidepressant medications, but they didn't actually investigate these other hypotheses as well. So kind of getting back to your question, how can we apply this when we're maybe doing patient education or even the history portion of the exam? And what I think the association tells us is when you have a patient who reports that they have depression, you want to consider looking for and doing an evaluation for dry eye disease. And then conversely, when you have a patient with dry eye disease, you can ask a few questions about their mental well-being. And I think taking that extra step could make a really big difference. Now, the other thing when it comes to the public health perspective is asking the question is not enough. You also have to be ready to have the resources or the triage or the communication plan. Because once you uncover the problem, you need to be ready. And if you say, I've noticed that there's sometimes an association between someone who has dry eye symptoms and a feeling of depression. How are you doing?
Mhm.
And when the patient comes back and says, doc, now that you ask, I think I might be depressed, you need to be ready with community-based resources or online resources or a template to be able to communicate with their primary care physician to take those next steps.
Yeah, right. I think oftentimes we're so good at managing, our patients' dry eyes, but we fail to, explore their overall well-being. Students are so good at saying, Dr. Duong, they have dry eyes and I know all these treatments for them, but, how about their, overall health? And so I think you bring up a very good point that, as optometrists, we really play a role in, a patient's interdisciplinary care as well. Are there,
Absolutely. Yeah.
yeah, are there any, additional closing thoughts you may have?
So I think about that you can save a life when you stop, and optometrists are so good at listening to their patients. They're so good at that long-term relationship. And people are struggling now, more than ever with society, with all the stressors happening in the world. It really can affect people. So I think it would be amazing if down the road, those dry eye signs and symptoms could actually become a screening tool to help us identify and support people with mental health needs. So taking that extra step, asking those couple of additional questions could save a life. And I think we're uniquely poised to be able to help our patients in that regard.
Yes. And, hopefully with more research, we can all, play a bigger role in supporting those with mental health needs. Thank you so much for your insight today. I know I learned a lot of great takeaways that I'll be incorporating into my clinical care of dry eye. So thank you so much for your time, Dr. Hoppe.
Thank you for the opportunity.